Hello, and welcome to our next presentation. On behalf of the MIT CDOIQ Virtual Symposium, we'd like to thank all of our sponsors who have continued to support the symposium during this very challenging year. Before we thank our partners, we'd like to ask that sometime during the symposium's breaks that you visit our partners' virtual booths. You can also visit the Content Hub on the MIT CDOIQ website for some great partner resources. We'd like to thank the following partners: Deloitte, Informatica, Privacy Analytics, DAWX, Fusion Alliance, KPMG, Sandal Consultants, Tamer, Elation, Ali Data, Big ID, Boomi, Caserta, Citizen, Data Kitchen, Garage, Wakira, Pylog, Click, ThoughtSpot, Eckerson, Global IDs, Snowflake, Starburst. And as I said, please make every effort to visit our partners, use the virtual passport, because without them and our partner support, the symposium could not be held. Thank you.
So good afternoon, everybody. It's a little bit just past the hour of 2 o'clock here on the East Coast, and I want to welcome you to the afternoon sessions, to the first day of the 14th annual MIT CDO conference. You're hearing the disembodied voice of Peter Aiken, who is stuck in a place in the world where the internet does not exist as much as we'd like it to. But luckily, our three people who are going to be talking to you are ready and available to go. Mark Johnson, who I've known for a number of years, helps us with a number of the different initiatives we have around, a fine speaker in his own right, and David Holtz, who is, I don't want to give you the impression that he's just a PhD candidate. He's actually quite a business person with a fair history that I'm sure you're going to hear some about it, but he's also finishing up his PhD with the Information Technology Group at MIT Sloan. So a very, very good crowd here today, and they're going to introduce something called the Places Dataset. And that's going to be kind of an interesting piece. The context in which Mark and David are going to speak to us has to do, of course, with COVID right now, because that's the area where data can be, at least at this point, the most leveraged. So with that, Mark, I'll turn it over to you, sir. Did we lose Mark? How about David? Are you there? Anybody?
This is Mark. It looks like I've got some. I'm here. It looks like I've got a little, and I'm not sure exactly what's happening here, but can you guys hear that feedback?
We can.
I don't know why that's
Sounds like another session. Yeah. Can you mute?
Yeah, it looks like there's another session happening.
Something that I've been presenting in organizations and groups for a long time.
I can tell anyway.
One of the first presentations.
Thomas, any clues? What's going on here?
Was soon after I'd been hired by the Weather Channel companies, and I was presenting.
That's track A.
The Philadelphia
presenting.
Yeah, you want to be in track D.
I think that's where I am.
This is where track D is. So I don't know why that's leading over into our
weather,
session.
Or how I learned to stop worrying and love the Weather Channel. Okay. The reason that I came up with that title was because and I'll be talking about this.
Can you turn down your computer volume?
By leveraging weather data.
So if I turn down, I don't know if you guys can hear me still.
Yep,
but
we're good.
We can.
I don't know that I'm in that track. I guess that's why I'm a little
discombobulated. Yeah, it is.
Hold on.
It was relevant in 2000.
All right, there we go. I think it was my problem, and I apologize for that. Hopefully everybody can hear me now. Can you hear me now?
We can hear you fine, Mark.
Yes, we're good.
Sorry about that. All right, so let me just share my screen and we'll get started. Just give me 1 second. Apologize for that. Share the screen. And let's see here. All right, we'll get started. Hopefully everyone can see the screen.
We can. You're looking good.
All right, thank you very much. And let me just get a few things out of the way as we get started here. And thank you all for joining. Sorry about that technology glitch there. All right, so how data and analytics are powering the new world order. We're excited about the conversation today. With me, and I'll introduce my co-presenter, David Holtz. He'll be presenting the we have here, but we're going to talk about the Safegraph Data Set, which is an anonymized GPS data set from multiple mobile apps with opt-in tracking enabled to generate a rich movement and placement data set. And Fusion Alliance has actually been interested in partnering with Safegraph for consumption of their data in a number of our machine learning use case scenarios. So we're excited to have them be a part of this presentation today. And then we're going to, after we have a presentation of the data, we're going to talk about a particular case study that's related to COVID. And then we'll open it up for questions at the end. I'm Mark Johnson. I'm the executive leader of data management analytics for Fusion Alliance. I'm also, if you heard earlier this morning in the introductory comments, the launch of the CDO magazine, I'm the editorial board chair for the publication. So I've been around the data space for quite some time and have a lot of experience over a number of different tracks there. Also today with me is David Holtz, and he's a PhD candidate at MIT, but he's done a lot of work in data science and analytics, and most recently working with Airbnb, Facebook, and Spotify. David holds a number of different degrees and certifications, and it's pretty exciting to hear him talk. So I think we're going to have quite a treat today. So I want to go ahead and talk to you a little bit about the Safegraph movement and places data set to sort of set this up. And Safegraph is really, it's just the source of truth for physical places. They're just a data company, and what they offer is a data set that is really a compilation of over 6 million core places. So those are business listings for physical places like gyms, restaurants, coffee shops, banks, other locations around the United States. They also provide the geometry of those spaces, so the building footprints with a spatial hierarchy for the point of interest. So they have the general outline of the particular space that has been identified as one of the core places. And then they're interestingly able to connect that with neighborhood patterns, which are census block group visit patterns and mobility insights that are tied together through the places patterns, which you see here in the center. And so the places patterns, again, are derived from over 35 million anonymized mobile devices, which provides a very, very rich set of data. And we'll talk a little bit about what that really provides. But it's a pretty innovative set of data that's now available and is being consumed in a number of different use cases. So the hard problem is, how do we build patterns for foot traffic? And think about physical locations, it's really necessary to understand when foot traffic actually enters the space. So that's where the geometric footprint really comes into play to define what a physical point of interest is from a spaces perspective. Of course, the GPS data plus the places data using machine learning to do anomaly detection and validation together with true set precision set of visits that can be analyzed in a number of different scenarios. So ultimately, what Safegraph is driving toward is geospatial innovation, and their mission is to power innovation through open access to geospatial data, and to ultimately turn that into what they're going to be launching in October, which we're really excited about, which is their place key identifier. So it'll be a free identifier for physical places, and you can learn more about that at placekey.io. The site is listed there. But they've done a lot of work, and their work is being consumed in consortiums on their data set. Their data set is being consumed in consortiums in the public space. You can see a number of the collaborators there in terms of using the data set for analytics that have been mounted here recently, and certainly given the COVID-19 pandemic, there's been a lot of interest in the movement of people and the spread of the pandemic and the management of that. So here are a few recent analyses of the Safegraph data, and there's a little bit of press here that you can see. I like this piece at the bottom. The Dallas Fed has been using Safegraph's data in its own economic modeling and forecasting. The resulting charts constitute a key metric in forming our assessment on the economic conditions and the outlook for the future. So that's a pretty interesting analysis that's been mounted. But economists are using the data, and certainly healthcare and public health officials are using it to pull together analytics that help inform. Now, this, I'm sorry, let me go back to this slide. The next slide here is really sort of a graph of the impacts of COVID-19 in the United States. So these are just some examples to give you some insight into the value of some of the use cases that this data has been participating in. But here you have a graph of across all industries. So you can see airports on the top, and supermarkets on the bottom, and you can see movie theaters are here in the gray line. So, as the pandemic onset, using the Safegraph data set to look at the movements of individuals from their homes to various points of interest that have been categorized, you can see that movie theaters took the largest dip and have stayed really on the bottom of the recovery of the segments that are represented here. However, you take a look at grocery store outlets, you can see that the traffic patterns took a big dip initially, so took a spike initially and then a dip, but have kind of leveled out there. And there are a number of reasons behind that. But these things that you see, initially everybody sort of went into hoarding mode and went to consume all the products they could, get safely in the categories that were necessary to weather the storm, and then began to shop online or have grocery delivery happening. We know that sales, if you look at sales in the grocery industry, online sales have, really gone up quite significantly. As a matter of fact, Kroger Corporation just announced almost 100% increase in online sales from the same period in 2019 for the first 6 months of this year. But here you can look at brand specific patterns. So here, if we look at, for example, Costco, Home Depot, McDonald's, Starbucks, Target, and Walmart, you can see that Home Depot really has outperformed everyone. And of course, we know that people went home and began to mount home improvement projects to take advantage of the time that they were spending at home. But there are a couple other categories shown here. This is the impact of foot traffic in regions of the country. So you can look, by region, and then of course you can look also across restaurants. And interestingly enough, the softest impact was to the Mexican food restaurant category. That seems to have been pretty resilient throughout. But you can see some of the analyses that are now possible using the Safegraph data set. And David will talk a lot about some of the granularity of how that data set is being used. Here's another interesting analysis that was published in the Washington Post, which really chronicled at-risk retailers. A couple of really interesting ones to note here. Joann Fabric, which is listed here to the right, seems to be pretty resilient if you look at the curve of the impact that their business took with regard to foot traffic. That changed, changed dramatically initially, but it rebounded pretty well. So that's interesting. And also, if you look, for example, at JCPenney's just right next door to the left, they kind of hit the bottom and stayed there. So this was a really interesting insight to forecast the fortunes of a number of retail brands that we're all familiar with. This data has really been very useful in forming this type of analysis. Here's another use case. I'm just going to move over pretty quickly, but this is an impact on tourism. So you can see the various regions of the country where this data has been analyzed. Traffic patterns really slowed as a destination to places in those areas, and from other parts of the country, you can see the impact to the areas that took the largest hit in red, shown on this chart. So with that, I want to just go ahead and turn this over to David Holtz and let him introduce himself and set up the case study. And David, I'll advance the slides. You just tell me when and which direction, and we'll continue. So if your mic is off, I'm going to mute myself and let you go ahead and take it away.
Great. Thank you so much for the intro, Mark, and for providing that context on the Safegraph data. Today, I'm going to be talking about a recent paper that myself and 15 collaborators in our lab at MIT published just last month in the Proceedings of the National Academy of Sciences. That paper is called Interdependence and the Cost of Uncoordinated Responses to COVID-19. And in this paper, just to give a sort of 30,000 feet in the sky overview before we get into the details, what we're looking at is the extent to which different counties or states across the US, if they're implementing their social distancing policies in an uncoordinated way, what are the implications of that? So do the policies in a neighboring state or a faraway state that my state is very connected to, do those policies impact the mobility outcomes in my own state? And what are the potential costs in the event that that action is not coordinated, if there are these types of spillovers between states or counties or things like that? And to sort of just connect this back to the higher level point, which is all of these uses that one can get out of this detailed mobility data like is provided by Safegraph. If we can just advance to the next slide. Yeah, so these sort of large-scale digital trace data sets are very valuable. And so the type of data that you're getting from a provider like Safegraph is just providing an unprecedented amount of insight into how people are moving through space. And so an analysis like ours, which looks a lot at how many devices are leaving their home on a given day, or when devices do leave their home, how many different places are they visiting, would have just been impossible at population scale without the existence of these data sets. Sure, you maybe could have relied on transaction data, but then you're not measuring trips to other people's homes or to parks. Yes, you could run surveys, but maybe people don't respond truthfully because they feel bad about going out or something. Not to mention just the difficulty of scaling up that analysis to the entire US population, or even a population larger than the US. And so these data sets are just providing a lot of opportunities for new types of analyses that would have not been possible previously. And another thing that's powerful about them that I want to highlight, and is kind of foundational to the work that I'm about to show, is that these data sets can actually be combined with tons of other data, right? So I mentioned transaction data earlier. You can imagine joining movement data with transaction data to sort of understand where's the foot traffic going, but also, are people spending more or less money conditional on going to a particular place? You can imagine combining this with survey data, with data that's collected by government entities, with data collected by like Facebook or Twitter. The possibilities are limitless. To sort of highlight one example, over here on the left is a figure from another paper, which is actually also published in PNAS by some co-authors on our paper. And what they're basically doing is trying to understand the costs and benefits associated with opening different types of businesses. And so they were able to use Safegraph data and those footprints of these businesses to understand how much traffic is there to these different types of businesses, how dense is the how densely are these places filled when people are there, and so how much COVID-19 risk do they actually carry? And then they can combine that with survey data, which actually asks respondents, how much economic value do you place on going to a movie theater or a bar or a home improvement store? And so once you understand the health risk along with the economic value, you can actually do some analysis that can provide insight to government officials or policymakers when they're trying to decide how to design these reopening or closure policies that different governments are putting into place. And so really just the existence of data sets like this has created tons of new opportunities to optimize outcomes, both of your, someone in business who's thinking about different types of strategic decisions that you need to make, but also if you're someone in, say, civic tech or government, and you're just thinking about how to design interventions or programs or plan infrastructure build-outs or things like that. So these data sets are really exciting, provide just the opportunity to do analysis that would not have been done previously, and really valuable, I would say. So now to dive into what we actually did. So in our paper, we were trying to understand, as I said, the sort of magnitude of these spillovers that exist between counties or states when they're implementing their own shelter-in-place policies, and then also trying to quantify, if these spillovers do exist, what's the cost of discoordination? To provide an oversight of some of the background literature, as I think is kind of a commonly held piece of information by August 2020, early on, and even now during the COVID-19 pandemic, the disease was spreading by people traveling around the world, right? So on the left here, I'm showing a figure that shows in China early on in the pandemic, how many cases of COVID-19 were found in a given city as a function of the population outflow into that city from Wuhan, where the virus originated. And so you can see a pretty clear pattern where the more people that were into Wuhan, the more COVID-19 cases there were. There's also some early evidence, although it's not causal, so it's just an association, that shows that when different cities or provinces or counties or states put social distancing policies into effect, that actually slows the spread of the disease. So on the right here, I'm showing you a week by week data on whether or not there's growth in the number of COVID-19 cases. And so the top row is showing you data from pre-shelter in place, and then the bottom row is showing you data from post-shelter in place. And so the thing to sort of focus on in this chart is that in the top row, the growth rate is at first neutral, and then it's starting to become very positive. And then once these shelter-in-place policies are put into effect, that growth rate, starts to become less positive, and in fact, eventually becomes negative. And so we have some evidence that maybe these shelter-in-place policies are working, but you might worry that the effects that you're seeing in this chart are not causal, right? So maybe people are putting the effects in the policies into effect at the same time that people are just starting to organically change their behaviors. And so a change in behavior that you might attribute to the policies might actually just be due to people's non-policy related changes in how they're going about their lives. So if we can go to the next slide, that'd be great. So what a lot of researchers have started doing in the previous months, and actually a lot of this analysis has also been done with Safegraph data, is they've been using, sort of federalism in the US sort of gives us a gift, and they've been using variation in the timing with which different counties or states or cities enact shelter-in-place policies to actually see the extent to which these policies causally change people's mobility behavior. And so all the way on the left, this is sort of the overall effect. And so 0 on this chart is when the policy was put into effect on the x-axis. And so you can see that there's really no change to mobility before the policy is put into effect. And then once the policy is put into effect, there's this big positive jump. And so what this is showing is that when a given government entity puts a shelter-in-place policy into effect, that actually does lead to a reduction in mobility levels. Some of this analysis has also shown that the extent to which these policies work is actually moderated by a lot of interesting characteristics of the populations in the places where these policies are put into effect. So for instance, in the middle, you're seeing the difference between shelter-in-place policies in districts that are Democrat voting and districts that are Republican voting. So joining this location data into historical voting data. And what you're seeing is that there is some sort of partisanship to how people respond to these policies. So they're much more effective at curbing mobility in Democratic counties, whereas in Republican ones, there's not as much of an effect. Similarly, on the right, this is showing you how effective these policies are as a function of whether or not a given county has access to high quality broadband internet. And so the dark bars are low quality internet, the gray bars are high quality internet. On the left, you're seeing data from before the shelter-in-place policy. On the right-hand side, you're seeing data from after. And so the upshot here is that they are the same before, but that after the policy is put into effect, mobility does change in both the high and low internet counties, but the effect is much larger in the high internet counties. And this makes sense because maybe it's just easier to work from home if you have a good internet connections that you can actually do your work from home. You can also reason that maybe the internet connectivity is better in places like cities or less rural areas, where maybe the work tends to be more information work that can actually be done remotely. If you're in parts of the country where a lot of the work is, farming or factory work or types of labor like that, it's, maybe harder, if not impossible, to work from home. And so, all these previous studies have found these direct effects of social distancing policies in terms of how they affect mobility. But the thing that they don't really think about is the ways in which these different counties or states are all connected with each other, right? They sort of treat different counties or states as if they exist in a vacuum. And maybe that assumption, while good for a first pass through the data, is not necessarily accurate. So if we can go to the next slide then, what this is showing is basically the ways in which the United States is connected both socially and geographically. And I maybe mentioned this earlier, but everything I show you, this analysis is limited to the US. But you can imagine a lot of the same findings holding for the globe more broadly, or EU or Asia. There's nothing US specific about this. So the top row is showing you connections to Middlesex County, which is where Boston is located. And then the bottom row is showing you connections to Santa Barbara County near Los Angeles. And so all the way over to the left, we see what we call the social connectedness index, which is basically taking data from Facebook on the number of friendships that exist between different US counties, weighting it by census data to get population in these different counties, and just quantifying for Middlesex County or for Santa Barbara County how many Facebook friendships are there to these different counties around the country. And so you can see that, yeah, there are a lot of connections to counties that are nearby, which does make sense, right? You tend to be friends with people who live nearby you, but there are also a lot of connections that actually stretch further away. So people who live in Middlesex County also have a lot of friendships with people in California, perhaps because of business, right? Maybe people in Boston do a lot of business with people in San Francisco and LA, but also strong connections to places like Florida, where maybe a lot of older folks who have lived in the Northeast for a long time retire, you know, when they're ready to do so. In the middle, this is showing what we call this geomobility index, and this is actually constructed with Safegraph data. So we look at historical movement patterns between counties prior to the pandemic, and we just say how much movement is there on average between County A and County B. And so you can see that again, you know, from say Middlesex County, there is some movement to say Florida or California, and maybe that's people going on vacation or taking work trips. But you know, relative to the social connectedness index, this geographic mobility index is much more geographically concentrated. And so all the way over to the right, I'm showing you essentially the contrast between these two different you know, connectedness indices. So the social connectedness index and this mobility index. And the upshot here is that these indices are different, right? So there are certain counties relative to Middlesex or Santa Barbara, which are more strongly connected geographically, or which are more strongly connected socially. And so what you want to take away from this slide is that while these other studies have just looked at, you know, what happens in Middlesex County when Middlesex County implements shelter in place, or what happens in Santa Barbara County when Santa Barbara implements shelter in place, it might be worthwhile to think about how the policies in these different counties are interacting. And there's both a social component to this and a geographic component to this. So we can go to the next slide. So you might think, you know, why do I care about social connectedness, or why do I care about geographic connectedness? Does this actually matter? So there's a lot of prior research that actually shows that social influence online can actually affect things that you do in the physical world. So this chart all the way over to the left is showing a figure from a paper from a couple of years ago, and they look at data from a like a run tracking app, like a Strava or a Nike Runkeeper or a Track My Run kind of thing. And they measure the influence that my friend's running behavior has on my own running behavior. And so what they find is that there's a causal link between how much my peers run and how much I run. So the more my friends run, the more I'll run. The harder they run, the harder that I will run. The faster that they run, the faster I'll run. So the peer behavior that I'm seeing through this digital device is actually affecting what I do offline. Similarly, in the middle, we're looking at whether or not people choose to install different apps or adopt different behaviors based on what they see their friends on Facebook do. And again, in this case, we see that when you see your friends on Facebook installing a given app, that actually has a causal effect on the apps that you're going to choose to install. And that actually varies by some interesting attributes of people. So what's their gender maybe, or what's their age range, things like that. And then a final example that is maybe particularly relevant right now, given its election season, is this paper conducted by researchers at Facebook back in 2012 found that there's actually a causal effect of seeing some of your friends voting, that they voted on whether or not you're going to vote. So they did this large scale study that joins data from Facebook with voter file data. And they actually find that when they randomly show you that your friends have gone and voted on election day, that actually raises the probability that you will go vote. So the upshot here again is that these digital connections, these social connections, can actually affect the things that you do offline. If we can go to the next slide, this is going to show you that the same thing is true geographically. So this is a figure that's taken from a 1998 paper that looks at different crime-related policies that are put into place in neighborhoods in Chicago, I believe. And so in each of these figures, the x-axis is showing the time since the neighboring neighborhood put a policy into effect, and it's showing the change in outcomes in a neighborhood that didn't even change their policy. And so similarly to those graphs that I was showing you that were built with Safegraph data a couple of slides ago, we see that there's a really large jump at 0, which is showing that in this case, which is a sort of crime deterrence, I believe it's a law about handguns and whether or not you can carry them. When my neighboring neighborhoods are putting these policies into effect, this is actually affecting the murder rate in my own neighborhood, even though my neighborhood didn't change their policies. And so there's some previous evidence in the research literature that suggests that these geographic connections between places are equally important for determining how policy affects outcomes. So if we can go to the next slide. So in our analysis, we combine Safegraph data with a number of different data sets. So we use Safegraph data. We also use data from Facebook. We're using census data. We're using data collected from weather stations. And the core workhorse of this research is a method that's called difference in differences. And the intuition behind difference in differences is that I have these different, in this case, these different sets of counties. And I'm going to assume that their outcomes that we're measuring, in this case, these mobility outcomes. So do devices leave their home location on a given day? Or how many locations do these devices visit on a given day? That they move in parallel, right? So they don't need to be the same, but the movement patterns need to move in parallel. And so then we have this change that occurs, in this case, either my own county or some of these connected counties putting shelter in place into effect. And we see a deviation from that parallel trend. And so we assume that that parallel trend would have just continued, for infinity into the future, absent that change, in this case, the social distancing policy. Then we can use the difference between the parallel trends and the non-parallel trends to actually tease out causal effect. And so we're showing these parallel trends here for these two different types of outcomes using Safegraph data. And we've split all the different counties in the US into 4 different quartiles, depending on when they put shelter in place into effect. And so for counties in this first quartile, they put shelter in place first. They were among the first counties to really take COVID-19 seriously and put a policy into effect. Whereas counties in this 4th quartile put shelter in place into effect the latest, or maybe never even put it into effect at all. And so the lines are thin when a given county or a quartile of counties has not put shelter in place into effect. And then the lines become bold once shelter in place is put into effect. And so the things to note here are that these lines do in fact seem to move in parallel prior to the introduction of the policies. Also that once these lines start to become bold and the policies are put into effect, the amount of space between the lines is actually changing. So there's evidence that the parallel trends are actually breaking once the policies change. And also one thing I'd note is that for both outcomes across all of the quartiles, mobility starts to go down well before the counties start putting shelter in place policies into effect. And so what this is saying is that while we might look around and say, wow, very few people are going out to the extent that they used to, maybe not all of that change in behavior is attributable to shelter in place policies. A lot of it might just be people becoming more risk averse, or having employers who have put work from home policies into effect. And so the actual causal effect of these policies might be quite a bit smaller than what we would think if we just looked at the observational data and didn't do something like this difference in differences causal identification strategy. So we can go to the next slide. So to get into the actual results. So let's look at this figure on the left here first. And this is showing, the 2 panes here are showing these 2 different types of outcomes. So I believe the top here is whether or not you're leaving home at all on a given day. And then the bottom is whether or not, how many devices, how many locations a device visits on a given day. And we do all of our analyses using the Safegraph data, as I mentioned. And we also replicate our analyses using a data set provided by the Data for Good initiative at Facebook. And we were actually able to replicate all of our results across these 2 data sets pretty much, which is very encouraging that, both of these data sets are representative, and there's nothing about one data set or the other that means that our inferences might not be accurate. And so in both of these panes, if you look above the black horizontal line, this is the estimates that we get from a difference in differences model that does not take into account any of those geographic connections or any of those social connections. So this is very similar to what these previous papers have done that have used Safegraph data to measure the effect of shelter in place. And we find that shelter in place policies reduce the number of devices that are leaving home by about 4%, and that they reduce the number of locations that devices visit by about 6%. The next step, which is below that black line, is we say, okay, let's extend that difference in differences model and not just think about the policies of my own county, but also think about the policies of the counties to which my county is geographically connected. So the counties that people who live in my county travel to a lot, or that a lot of people are coming into from because of work. And so what we find is that when you actually estimate the effects of the policies this way, the estimated effect of my own county's policy is quite a bit smaller, and the effect of the policies set by those geographically connected counties is actually about as large as the effect of my own county's policy decisions. So this is saying that if I live in Middlesex County, I shouldn't only be worried about the policy decisions of my own county or my own state, but also maybe counties nearby in Connecticut or Rhode Island or New Hampshire, where people are commuting in from a lot for work or just traveling for leisure. In some sense, this is some of what we saw happen early on in the pandemic, right? So we heard about governors in New England coordinating their social distancing policies, or maybe the governors in California and Oregon and Washington coordinating their policies. And so this figure is telling us that was actually a pretty smart thing to do. Now, on the right, we extend that model even further, and we say, let's not only take into account those geographic connections, let's also take into account the social connections that exist between different counties or states. And so this is showing you, the estimates from a model where we actually differentiate between whether or not a county is within my state or in a different state. And so the black line, the black points here are models that only account for those geographic connections. And then the gray shaded points are models that take into account both the geographic and the social connections. And so what you want to take away from this is that when I actually estimate a model that does take into account those social connections, that the impact of the policies in my connected counties or connected states are much larger. And so one sort of summary of this analysis that I think really encapsulates things well is that if I take into account all of those socially connected and geographically connected states, if 1/3 of them put shelter in place into effect, that is as effective at curbing mobility in my home state as if my home state enacted its own policy. So all these connections actually do add up to having a pretty large effect on how much mobility there is in my county or in my state. So we can go on to the next slide. So you might be thinking, what actually drives these kind of spillover effects that I'm talking about? So why do the policies in my geographically connected counties or states influence mobility in my own county or state? Why do the policies in my socially connected counties or states influence, mobility in my own county or state? So on the left, I'm showing you the estimates from a slightly different model that looks at the amount of movement between every possible pair of counties in the US. And it looks at, what are the policy situations in that pair of states? So have both of them put shelter in place into effect? Have neither of them done so? Or has only one done so? And what we find is that when only the so-called origin county has put shelter in place into effect, that actually increases the amount of travel from the origin to the destination. So when I'm living in my home county and I can no longer go to restaurants, bars, movie theaters, etc., our analysis suggests that people are just going next door to the state that's not yet closed to do all of those things. And vice versa, when only the destination county has closed and the origin is still open, people are traveling to that destination less, right? So why go next door to the neighboring county that is totally closed down when I can just stay here in my own county where things are still open? And if both the destination and the origin have closed, travel between them, as you'd expect, goes down. On the right, I'm showing you the analyses from, or the results from an analysis that we did that tried to understand what's actually driving those social spillovers that I talked about earlier. And there are a couple of different mechanisms that you can hypothesize. So one that I'll suggest is that people just talk to each other and they're just talking about policies. And so you're just becoming aware of what's going on in other places. Maybe you're becoming more scared about the pandemic, and that's affecting your behavior, right? So that explanation would have nothing to do with whether or not my friends in other counties or states are going outside. It's just that I'm learning more because they're posting and saying, my governor just put shelter in place into effect or something like that. Another possibility is that it's actually the mobility behavior of my friends in these other locations that is affecting my own behavior, right? So maybe if I live in New York and my friends live in Illinois, when my friends stay in and are available to have drinks over Zoom or have a virtual board game night, that's going to increase the probability that I stay home and do those same things. Likewise, if my friends in Illinois are going out hiking or are going out to bars that are not shut down and are posting a lot of pictures and videos on social media, maybe that kind of induces me to go out because I have fear of missing out and I want to go socialize like my friends are doing. And so in this analysis, we treated the weather in a given location as basically random. And we can say, well, if it rains in Illinois, maybe that makes my friends not go out. That randomly affected their behavior. It's not raining here in New York. And so I can see if I'm less likely to go out when my friends in Illinois don't go out. And we actually find that to be true. So we find that, the top kind of row in each of these panes is showing you the effect of my own county shelter-in-place policy. And then the bottom row is showing you the effect of my friends in, outside counties or outside states actually staying home because it's raining. And what we're finding is that these social spillovers that I talked about earlier are actually substantially driven by changes in my friends' behavior. So it's not that they're telling me about policy and that's just getting me nervous, but it's actually that their decision of whether or not to go out during the pandemic is affecting whether or not I go out during the pandemic, even though in some cases they live thousands of miles away. If we can go on to the next slide. So one thing that we were able to do, which is really exciting, is we can take those social maps and those geographic maps that I showed you earlier on in the talk, and we can combine them with these effect estimates that we got from our analyses. And we were actually able to construct a map for every single state, as well as Washington, D.C., that says these are the other states whose policy decisions influence you the most. And sometimes the results here are maybe at first glance a little bit surprising. So to highlight some of the things in these three maps that sort of jump out to me, in the case of Florida, you might expect that nearby states like Georgia or Alabama would have the most influence. But in fact, we find that the most influential state in terms of Florida's outcomes is New York, which is quite far away. California is also quite influential. And so, what we suspect is driving this, as I mentioned earlier in the talk, is that there are actually quite strong social ties between Florida and New York, right? So maybe a lot of people retire to Florida after living in the Northeast for most of their lives. And so even though New York and Florida's governors might never think to coordinate because those two states are quite far away, our analysis suggests that New York's decisions are actually quite influential on mobility outcomes in Florida. If we look at Massachusetts, we see an instance of kind of the opposite. So a lot of the most influential states for Massachusetts are states like Connecticut and New Hampshire, which are quite small states. And so you might not expect their policy decisions to really move the needle for other states. But in this case, what's important is that they're very close, if not adjacent to Massachusetts. And so this is kind of highlighting the potential importance of these geographic connections that exist between states. And finally, all the way over on the right, this is showing you the map for Illinois. And I think the thing I want to highlight here is that Illinois is influenced by a ton of states, and a lot of them are very large. So Texas, California, Pennsylvania, New York. And so we do find that the largest states tend to influence tons of other states, which makes sense if you just think about, sort of population inflows and outflows between states across the United States. You're still seeing, somewhat nearby states like Wisconsin and Indiana also having influence over Illinois. But the upshot here is just that many states are sort of having an impact on whether or not mobility goes up and down in Illinois by way of their social distancing policy decisions. And when we actually calibrate an analytical model to our results, our estimates suggest that if the states in the US do not coordinate their social distancing policies, that can actually lead to outcomes that are 69% worse than in the ideal case where there's some kind of social planner who's kind of working with all the states to coordinate their policies. This isn't advocating for a one-size-fits-all policy necessarily, but just that there should be some effort to coordinate social distancing policies between the states. We've shared these maps with all of the governors across the US, and we're hoping that these maps that we've put together will be helpful for them in, kind of choosing who to work with when they're thinking about, reopenings, which is something that's on everyone's mind right now. So to go on to the next slide, just to sort of, I think that this work really highlights the amount of value that can be found from data like the data that's coming from Safegraph. So we use this movement data to build these adjacency maps. We use this movement data to construct our outcomes. So how many devices are leaving home? How many devices are, how many locations are those devices visiting? We also use Safegraph's data on particular locations and types of industries that people are visiting. I didn't go into that analysis, but we actually use that as another way to kind of get random variation in the extent to which my socially connected and distant friends are going out on a given day. And so that was another Safegraph data set that was valuable. And one thing that we did here, which I mentioned earlier, is we joined this with tons of other data. So we're joining it with census data, with weather data, with data from Facebook. And so a lot of the power here comes from combining different data sets and kind of, coming up with insights that kind of bridge these different data sets together. And so, obviously the work that we've done has public policy implications, but as I mentioned earlier, this can extend to, business, public planning, smart cities, et cetera. So to just recap some of the findings in this paper, so we found, consistent with previous studies, that social distancing policies do reduce focal county mobility. But we found that it's not only the mobility in your own county, it's also the mobility in other counties that your own county is connected to. And this can take the form of geographic spillovers that are mediated by travel between counties, but also these social spillovers that are mediated by peer behavior, that's taking place. We can use these models and combine them with these mobility and social connection maps to actually figure out which states are most influential on the outcomes of other states. And when we actually calibrate a model to our results, we find that this lack of coordination can actually be quite costly in terms of how much we're able to reduce mobility and subsequently the spread of COVID-19, both in the US, but also, as I said, more broadly in the rest of the world as well. So that's all I had to say. I'll kick it back to, I think, Mark, and I think maybe he has a little bit to say about some Safegraph data sets that might exist in the near future.
Yeah, so I think the place key data is really the exciting part that we're looking forward to coming forward. And we have Ryan, I believe, out from Safegraph on the call with us to answer questions. So I think what we should do is just open it up for Q&A at this point. And I'm going to turn my camera back on and stop sharing the screen. And go ahead, and Ryan, if you want to open up your microphone as well, just for any questions that we have coming in. So let's see who's there. Is it Peter? Are you handling the questions?
You betcha. So first question, somebody wants to know what the winning lotto number is going to be, David. So you seem to have so much data in the data set apparently that there's so they think you can predict the future on that. So I'm pretty sure that's a tongue-in-cheek one, but next question is, can you tell us more about the state influence, how states are influencing, what sort of things you're seeing there with this data set?
Yeah, sure. So I think I tried to get at this during the talk, but I would summarize the main findings or like the main takeaways as follows. So first, as I said, some of these, sort of influence pairs are operate at long range, right? So you might think, oh, if I'm in New England, maybe I just get to worry about the rest of New England. And our analysis suggests that, well, yeah, you should worry about what New England is doing, but you should also be thinking about Florida and California and Texas, and maybe some of these faraway states that you might not think about right away. The other thing that we found is that these geographically nearby states do matter, and that's even in spite of the fact that sometimes there are smaller states like New Hampshire or Vermont or Montana or something like that. And so that's something to keep into account as well. The final thing I'd say is that if you look at all of these different influence maps that we put together, you do see that the largest states in terms of population, so California, New York, Texas, Pennsylvania, they do show up a lot. And so the amount of influence that a given state has does seem to be quite correlated with the size of the state, which, I think is pretty intuitive in that, most people know tons of people from California because there are just a lot of Californians. But if you're curious, I would, if you go look up the full paper online, in the appendix, we actually have published the full set of all 50 of those maps, or I guess 50 to do DC. And so, it's definitely fun to kind of dig into those and try to, see what's going on.
Absolutely. Thank you. Another question, somebody was saying there's apparently an article in the Post or something today, and this is probably for everybody on the group here, that says Las Vegas is trying to kill us based on location data. I don't know if you guys saw that article or not. I did not see it, so I'm not sure what the implications there, but everybody else has seen it either? All right, we'll have to read the paper then to take a look.
I haven't seen the article yet. Symposium has had me confused.
Apparently it was based on location of cell phones and things, yeah. But I'm just trying to pick that up from there. So if we look at what you guys are putting together, let's assume you guys make a breakthrough on this. And I'm convinced that you've got the data to actually say this, and that this is clearly a super useful combination that you put together. Who do we take this to, I think is what the questioner is trying to ask. How do we take what you're doing and make it effective?
In terms of this particular paper, or with Safegraph data and location data more generally?
I'm not sure what they're asking on.
Cool. I mean, maybe I can quickly answer with regards to this particular paper, and then maybe Mark or Ryan have something to say about general data. I mean, I think for this particular paper, as I mentioned, we've been trying to get this into the hands of governors or other government officials. Have been trying to have people in the press write about this, because I think it's an intuitive idea that we're kind of all in this together, and that when some states are shutting down and others are reopening, that's going to make it harder for everyone to kind of eradicate the virus. And so I think if you think about the next step and what would they actually do is, if I'm Andrew Cuomo and I'm trying to figure out which governors I have on speed dial every night that I'm talking to when discussing next steps in terms of controlling the pandemic, maybe the governor of Florida is someone that he should be speaking to more or less. I guess in our case, more, right? And maybe similarly, he should be talking more to Gavin Newsom or Jerry Brown or someone like that. And so really just having information that helps policymakers really understand the ways in which different parts of the country are connected in terms of social connections and geographic mobility can help us just set policy more efficiently and effectively.
I can add on to that. Hi, I'm Ryan. I'm part of the Safegraph team. I think just more broadly, like Safegraph's perspective on a lot of this has been, we find ourselves in a position where we have this data that seems to be very relevant and valuable for understanding policies and making decisions. And so Safegraph has just tried to make that data available as much as possible to anyone working in government or in academia that's trying to answer these questions. I think Dave's work is a great example of that, and we're working with thousands of other people as well. I think at the high level, right, like everyone's trying to understand what are the right policies to put together that are going to protect people without overly killing the economy. And so to be able to do that, you need to have outcome measures, which Safegraph data can help. And you also need to understand like these other relevant factors that contribute to those outcome measures that I think like the work we saw here today really illustrates. But from Safegraph's perspective, we're really just trying to make the data available to people that think they can help and try to make that as easy as possible. So that's been our perspective.
I can add to that as well. And in terms of just thinking about the commercial applications of the data, we have a number of clients who are, obviously looking at human capital strategy and how they're going to plan reentry to the workforce and what that looks like. And so understanding mobility and social connectedness is a part of the use case ideation that is going on in collaboration among a number of our clients in CDO collaboration groups that we're participating in, who are looking for ways to apply this kind of a data set to help visualize what's happening in the geographies where their businesses are located, and how people are moving around. You know, for example, in Southern Ohio, you know, which borders, Cincinnati borders Kentucky. So there are different policies going on in Kentucky in terms of shelter in place or stay at home, you know, policies and guidelines versus in Ohio. And yet that population, that border is very porous because people move back and forth across it for, you know, commercial purposes every day. And so those kinds of analyses are really starting to a lot of you know, foothold in the commercial space around human capital strategy, and you know, to try to give visibility to how to better, as employer stakeholders, help, you know, complement the efforts of the public entities who are putting shelter in place policies and, you know, in force.
Thanks, Mark. Thanks, Brian. Another question: does Safegraph, excuse me, allow distinction between modes of transit, between geographic places, say bus routes, roadway location, etc.?
So the short answer is no. The way that one of the high-level strategies that Safegraph has about how to make this data valuable while protecting individual privacy is that all of our data products are aggregated measures of behavior. So all of these things that, for example, that like Dave was showing are based on aggregate movement patterns, aggregated by day or by week or by month. But as part of that sort of product decision to do those aggregations, we have not attempted to sort of segregate modes of transit. I know that there are other ways you can get this type of data that in a more raw form that would maybe allow that type of analysis, but that's not something that Safegraph does, and that's sort of just part of the product decision of how we've aggregated the data. And yeah, I don't know if Dave, if you have any other thoughts about that, or how that's impacted your work with the data.
Yeah, I mean, obviously there are certain things where I think, you know, if you could differentiate between modes of travel, or say if you could track an individual device and see where it's going, maybe there are certain questions that you could answer that are maybe hard, if not impossible, to answer with the aggregate data. But I think something that's nice about aggregating the data is that, you know, Safegraph has definitely put their data together with privacy in mind, right, both in terms of aggregating the data and then also applying, say, differential privacy algorithms to the data in, you know, parts of the country where maybe the density of the population is quite low. And so, you know, I think keeping privacy in mind is important, and it's something that this data set does quite well.
Super. Well, we've got time for just one last question. I think it kind of wraps up what you guys have been working towards here. Somebody wants to know about what's going on with back to school. Let me see if I can read it properly here. Not sure if you have the data as yet, but do you have any data reflecting the mobility of people going back to school, or maybe there is no change in mobility?
I can say,
yeah, I was going to say, maybe you have something. Yeah, no, go.
I can just say briefly that, like, I think this is another example of like very important policy decision making that is going to have a huge impact on the country, and Safegraph Data, I think, does help understand those dynamics. I think a large part of that picture is looking, you know, over the last 5 months, what does the data tell us about how mobility and population density like impacts these things. There's been, you know, at this point, hundreds of studies sort of understanding the nuances of that. Hopefully those can influence our thinking as we think about back to school policies. Going forward, Safegraph Data will also be able to help monitor and understand how those policies are being implemented or not. We don't have any sort of actionable, you know, intelligence, you know, that speaks to what's going to happen, I think, but the hope would be that that we're learning as we're going, you know, collectively, and that the data could continue to help make informed decisions as we think about how to go back to school and how to balance the benefits and costs of doing that.
Absolutely. Well, guys, it is at the top of the hour. So I want to thank Mark Johnson. I want to thank David Holtz, and I want to thank Ryan. Sorry, Ryan, I got your last name covered up here. Hang on. Say your last name for me.
Squire, Ryan Squire. Thank you.
There we go. Thanks. I could get the S, but that was about it. Very interesting talk. And I think we're going to see some of the work that they're doing in future sessions on this, because you sounded like you were inviting collaborators in. How would people, if they were interested in collaborating, get a hold of you guys?
I can
So,
start by saying that if
go
anyone's
ahead.
interested in working with Safegraph Data, you can go to safegraph.com, and there's going to be a link to join the data consortium. This is anyone who's working to understand COVID-19 or other public good uses are welcome to join that. And that's our sort of platform for giving people access to the data and tracking that. So I definitely encourage everyone to visit safegraph.com and join the consortium if you're interested. And then I think Dave and Mark probably have other follow-ups contacts if you want to talk to them specifically.
Yeah. Mark, can we go next?
Go ahead, David.
Sure. On my end, my personal website is daveholtz.net, and I think my email address and other contact info is there. So if anyone has any questions about the paper or would like to talk more about implications of the paper or anything like that, definitely feel free to find my contact information and reach out. Happy to talk more about that.
And then
good luck with your finish up.
And I'm
Mark, sorry.
All right, I'm at fusionalliance.com. You can reach out to Fusion. Our ML group is starting to do a lot of case studies and POCs with this type of data and data set. So we're always available to help if on the commercial side there's interest there as well. So.
Terrific. Well, again, thank the three of you for doing a great presentation today here, and we'll wrap this session. I don't think we've got a yoga session in between, but we'll join everybody back here at 3:30. Again, thank you guys very, very much for this.
Thanks. Bye-bye.
Thank you.